Okay, recording.
Okay, good morning or afternoon. We are so excited to be here with you today. My name is Alena Shalaby, and this is my boss, Meghan McGurk. We are part of the Healthy Hawaii Evaluation Team at the University of Hawaii at Manoa. And in our presentation today, we're going to be thinking through interventions at the organizational and policy level, building off of what Dr. Santel mentioned about the social ecological model. Okay, just to give you a brief overview into our presentation, we will briefly describe our work in evaluation. We then will provide you with a background about health in Hawaii and the Department of Health. To provide you with a little bit more context and examples regarding evaluation work, we will go into describing our work with Choose Healthy Now, the Nutritional Project, and also the Healthy Kids Meal Beverage Law. And at the end of the presentation, we will leave you with a few concluding remarks and open the space up for questions or feedback. Okay, so as the Healthy Hawaii Evaluation Team, we serve as external evaluators and focus on various topical areas. So these include reducing tobacco use, physical activity, poor nutrition, and providing evaluation work to support the chronic disease management programs that are priorities for the DOH's Chronic Disease Prevention and Health Promotion Division. So to do this work, we often partner with universities, at the local and international level, such as yourself, such as UFRN, to conduct research related to our focus areas. So in our work, as we mentioned, we partner with the Hawaii Department of Health and specifically their Chronic Disease and Health Promotion Division. So our team, just for some background information, has been partners with the DOH for over 20 years. And the Department of Health conducts work to change policies, systems, and the environment to promote the health of people here in Hawaii in various topical areas. So these topical areas include nutrition, physical activity, obesity, diabetes, heart disease, tobacco, cancer, and asthma. We bolded nutrition specifically as we'll be getting into 2 nutritional-based policies and campaigns that we will evaluate to assess their efficacy. So on the right here, again, we have the social ecological model, and we've bracketed the areas that we're going to be specifically focusing on today, right? So all the way from the organizational, the community, to the political level there. So we want to provide just a little bit more contextualizing information about what evaluation is and how it serves projects and what it has the capacity to do. So evaluation is a critical component of executing health interventions, policies, and campaigns, as evaluation can measure the impact of these things, provide evidence of health impact, which can then be used to inform policy or legislation to make critical changes when necessary from improving health behaviors and saving lives. So we are also able to, in our evaluation work, highlight the areas of success and growth for future iterations or even revisions into the policies, campaigns, and interventions that we are evaluating. So we believe that evaluation is also essential as it influences effective implementation of these efforts, and it also guides future research in areas of need. So here in Hawaii, our evaluation work consists across the 8 different islands here. So we are located on Oahu right there, which has approximately 1 million inhabitants and is where the main University of Hawaii is located, the University of Hawaii at Manoa. On the other islands, there are approximately over 400,000 folks, so Oahu is by far the most densely inhabited island, and our work extends statewide, as does the Department of Health, so we do serve all 8 islands. So in Hawaii, there are many different diverse peoples. So the main population groups are Native Hawaiian, Japanese, Chinese, Filipinos, and Caucasians. However, there still exists great disparities between these population groups. And as you can see here on the graph, these disparities are present based on zip code. So you can see the areas with the darker blue have the higher life expectancy rates, where the lighter the shade of blue into the green into the yellow are the lower life expectancy groups. And just for some geographically orienting information here, these yellow parts this is Oahu, the big circle here, these yellow parts on the west, there's Waianae, there's the east, and there's Waimanalo down below. These are inhabited by predominantly Native Hawaiians. To get more specific, here are the chronic diseases in Hawaii among adults and Native Hawaiians. So as you can see, each one of the listed chronic diseases, the records for these impacting Native Hawaiians are far above the state average, indicating the health disparities between Native Hawaiians and other population groups. So here we have asthma, diabetes, obesity, high blood pressure, and high cholesterol. And for each one of these chronic diseases, Native Hawaiians have far more higher rates compared to the rest of the population groups in Hawaii. So we also should mention the food security is troubling Hawaii as well. Hawaii has become less food sufficient over the past 30 years and spends approximately over $3 billion annually importing food. So 90% of our food is currently imported. This creates great dependency on packaged and imported foods. So in this graph, we provide a visual representation of food security by race and ethnicity. And as you can see, Native Hawaiian, Filipino, and other Pacific Islanders are disproportionately impacted by food insecurity compared to other race and ethnicity groups. So as we mentioned, the prevalence of food insecurity really catalyzes this dependence on packaged goods, and convenience stores often serve as food sources and are located predominantly in low-income communities. These convenience stores are pivotal stores within the communities as there are often few grocery stores around. So there's high amounts of food swamps, food deserts. And as they are convenience stores, they tend to sell unhealthier options compared to healthier options. So Megan is now going to transition into our Choose Healthy Now project and our evaluation work within the Choose Healthy Now project.
Thank you, Alena. So I will be talking about this nutrition intervention at the organizational level of the social ecological model. The Choose Healthy Now project was a project started by the Hawaii Department of Health in 2018 when they partnered with local convenience stores to increase the number of healthy options sold in convenience stores and then to add signage to help people to make healthier choices when they're shopping. Here's an example of some of the type of signage. Through this project, they added signs at the store shelves, as you can see here, to encourage people to make healthy choices where they are actually have the opportunity to make the choice. And this is called a point of decision prompt. And we know from other studies that point of decision prompts are effective at increasing the purchase of healthy products. In addition to the signage, they also launched a television commercial and radio commercial to educate the public about making healthy choices and to encourage more businesses to adopt this project. This campaign ran from 2017 to 2018. And so our team conducted 2 evaluation studies to first understand awareness of customers, customer awareness of the signage while they were in the store and what influence that awareness had on their purchases. And then to evaluate the effectiveness of the commercial to see if people were aware of it and if it impacted their purchases or decisions on healthy choices. So for the first evaluation study, we conducted this in November and December of 2017. We conducted exit surveys outside local convenience stores in 4 communities where there are high rates of Native Hawaiian, Pacific Islander, and Filipinos during lunchtime. We stopped people and asked them if they had time to take a 5-minute survey that included questions on if they had seen the Choose Healthy Now signage when they were in the store shopping just then, if it had influenced what they decided to purchase, and then what they actually bought while they were in the store. They were offered a small incentive while they were shopping as a means of incentivizing them to participate in the study. So the sample of participants included 162 people out of the 732 people we stopped. This is a 22% response rate, which is very comparable to what we've seen in other studies for this type of exit survey methodology. 59% of the participants were male, and then over half were Native Hawaiian, Pacific Islanders, and other Pacific Islanders, excuse me. Native Hawaiians, Filipinos and other Pacific Islanders. Of the people who participated in the survey, about 86% purchased either a food or beverage item when they were shopping, and 1 out of every 4 of those people purchased a Choose Healthy Now item, like a water or banana. We asked customers if they had seen this signage and showed them this slide, if they had recognized them from being in the store. And just other half of the customers said that they had seen the signs. However, only 13% of them had actually it said that the sign encouraged them to make a healthier choice or influence their purchases. And this was lower than what we've seen for other studies. Some of the reasons that people did not see the signs was that the majority actually knew what they were going to buy when they walked into the store and had no intention of changing their mind. And then also people said that convenience and price were the strongest drivers of their purchasing decisions, not health. In evaluating the impact of the commercial, we conducted a telephone survey using the Hawaii Behavioral Risk Factor Surveillance Survey, which is a national survey conducted in all 50 states, Puerto Rico, and Guam. And this is conducted to assess health behaviors of the nation. And sort of similar to your data SUS in Brazil. The study asked for demographic characteristics and then weighted based on those demographic characteristics, and we analyzed the data using the software Stata. The telephone survey asked questions about demographics such as sex, age, race, ethnicity, educational level, and the community of residents. We asked customers if they had seen or heard the commercial, and if they had shopped at a convenience store in the last 2 weeks, and if the commercial had influenced what they had purchased during their shopping at the convenience store. What we found was that about 35% of of telephone respondents said they recalled hearing or seeing the commercial, but there were no significant differences in recall of the commercial based on gender, level of education, or county of residence. Native Hawaiians and other Pacific Islanders were more likely to have recalled the commercial than other races and ethnicities, which is good since this was the target population for increasing access to healthy foods. 38% of the respondents reported that they bought a healthier item in the past 2 weeks as a result of seeing the commercial. And so in conclusion, about 1 out of every 3 people who heard or were aware of the radio or TV commercials, and about 1 out of every 3 said it impacted their choices. Native Hawaiians and other Pacific Islanders were more likely to have reported being aware of the commercial than other groups. We are aware that there is response bias in asking people over the telephone what they purchased and if it influenced their purchase. So we think that these numbers are a little bit inflated. But we also conducted the exit surveys and saw much lower rates. So 1 out of every 4 customers reported awareness, and 1 out of every 8 said it influenced their health behaviors. And when we actually asked them what they purchased, so that we think that the response bias was a little less in person. The private businesses would not share their sales data with us, so we were unable to look at changes in sales as if this influenced increases in purchasing. But they did tell us anecdotally that they did not lose any money by participating in this project, which really speaks to how the success of this project. And for the Department of Health, it was really a first effort to engage private businesses to prioritize health and offer healthy options and encourage healthy options for communities over profits and private and selling unhealthy beverages or unhealthy options. So the next intervention I'll talk about is at the policy level. It's the Healthy Kids Meal Beverage Law. And what we know from the literature is that frequent consumption of sugary drinks is associated with many chronic diseases, obesity, type 2 diabetes, and heart disease. And we know that consumption of sugary drinks is the largest contributor to sugar consumption in the American diet. We know that in Hawaii, Native Hawaiians and other Pacific Islanders have higher consumption of sugary drinks compared to other races and ethnicities. We know that children of low-income families are more likely to consume a sugary drink than wealthier families. And we know that consumption of sugary drinks early in life is a strong predictor of consumption of sugary drinks later in life. We also know that sugary drinks provide no nutritional value and are very often served as the default beverage that comes automatically with children's meals, such as a Happy Meal. They're often served with a soda or chocolate milk. And so this lack of healthy options for parents in Hawaii makes it very difficult for parents and children to make healthy choices when they're out shopping or eating in restaurants. So the state of Hawaii passed a law in January of 2020 to require restaurants to make the healthy options available as the default beverage option for children if they serve a children's meal. And some of the options that are considered healthy are low or non-fat milk that is plain and unsweetened, water, or 100% juice. That said, restaurants are able to offer sugary drinks upon request by the parent or child. They just can't serve it as the automatic beverage that comes and is given to children without request. These types of laws have actually gained popularity in the United States. There are several cities and municipalities that have such laws, but there are only 3 states, and Hawaii is the second state to have such a law. The law is really built on this idea of making the healthy choice the easy choice. And this is based on behavioral economics theory, which shows us that people are very accepting of the options that come automatically to them and are least likely to ask for a change of that default option. So, for example, if a person is given a water automatically with their Happy Meal, they will be less likely to request a change to a soda. They'll be more likely to just accept the water and drink it. So our team conducted a pre-law data collection in order to understand the landscape of healthy and unhealthy beverage options served to children before the law went into effect. We wanted to gather information to help inform the implementation of the law and to start a pre-post study in order to evaluate the effectiveness of the law at increasing healthy options for children. So in November and December of 2019, we conducted this baseline study from 18% of random sample of 18% of the restaurants with health permits in the state of Hawaii. So sample was 383 restaurants that were unique. And we had 2 independent raters review each of the menus either online or in person to establish if a children's meal was offered, what type of beverages were included in the children's meal, and if the drink met the compliance before the law went into effect. And we used a validated tool for the children's menu assessment tool. What we found is that just under half of the restaurants had any type of item for children. So a children's meal or any specific item like children's drink or children's fries. And this is an important thing to note. The law only applies to children's meals that are sold for a single price that come as a package, like a Happy Meal that comes with fries and a burger and a drink. It does not apply to restaurants that sell children's items that are separate. So like a French fry for $2 or a drink for $3 that are all separate. We found that 1 out of every 6 restaurants had a children's meal that would be subject to the law. So very few of the restaurants. And then of those that sold a children's meal that would be subject to the law, 61% served a unhealthy beverage automatically with the children's meal. Some of the unhealthy beverages served most commonly were soda, juice that had added sugar, and then high-fat milks. Only 2 of the restaurants in the sample actually were compliant with the law before it went into effect. And 12.5% actually offered a healthy beverage option automatically, but they were not compliant because they also offered items like chocolate milk or soda. So the implications of this law are that the Department of Health used this data to help inform how they were going to develop their rules and provide guidance to restaurants in order to help them comply. For example, the data that we shared enabled the Department of Health to recognize that a lot of restaurants just said on their menus that they offered a drink. They didn't specify what type of drink it was, if it was a soda or if it was 100% juice or if it was plain non-fat milk. And so this helped them to identify guidelines for restaurants. So they had to specify what the menu or what the drink offered actually was. Other implications from our data collection was we found that national and international restaurants actually had higher odds. 7.57 was our odds ratio of having a children's meal that would be subject to the law than restaurants that were not part of a chain. And so we really see this as significant because to make the biggest impact on children's beverage options, if we are able to engage national or international chains, we can have a really large impact on consumption of sugary drinks. And the previous study that we showed from the Choose Healthy Now project shows that these private business and public government health agency partnerships really can work to improve or create healthy options for the people of Hawaii. Unfortunately, right after the law went into effect, which was January 2020, the COVID-19 pandemic happened, and that really delayed the implementation of this law. Hawaii really shut down to prevent COVID spread. There was no tourism. A lot of the restaurants shut down, which caused many restaurants to close and to increase the prices of their items or cut items from their menu in order to save their bottom line. But the Department of Health has started picking up activities again. They have developed a website for restaurants to self-certify that they have a healthy beverage option for their children's meal for children. And they will have launched that in July. And so next steps for our team are to conduct the follow-up data collection, so post-law data collection in November of this year, to really see if the law has resulted in healthier beverage options for children in Hawaii. We also have learned from other studies in California and Delaware that the cashiers or staff at restaurants are not always offering healthy beverage options, even if the menus have changed. And so we really want to understand if the restaurants in Hawaii have trained their staff to verbally offer healthy beverages first to families, because we know this is a strong impact, will have a strong impact on whether or not this law is effective. So in conclusion, we knew that found that before the law, children's meals predominantly served unhealthy beverages with sugar and no nutritional value. We know from studies in California that healthy kids meal beverage laws can be effective at increasing access to healthy beverage options and reducing access to sugary drinks. And in order to make healthy choices, the easy choices for families, this is a really great opportunity, such as the healthy default beverage law. So in conclusion, policy and organizational interventions are really leverage points to help reduce obesity and other chronic diseases across the lifespan. And evaluating these efforts is really critical to establishing their impact and improving their effectiveness. Thank you. Oops, hold on.
Oh man.
I forgot to
Good
record.
job.
Wait, I forgot to stop recording. Hold on.
Yeah, I know.
I don't know where it went. Okay.